Diabetic ketoacidosis, or DKA, is a serious complication of diabetes that requires immediate medical attention. But how do you recognize it, and what steps should you take? Let's break it down. First, when should you suspect DKA? Look for these key signs. A history of diabetes. Symptoms like abdominal pain, nausea, and vomiting. Increased urination and extreme thirst. Confusion, disorientation, or even coma in severe cases. Rapid, deep breathing, known as Kussmaul's breathing. And a distinctive acetone odor on the patient's breath. During history taking, ask important questions. Is the patient a known diabetic, or is there a family history of diabetes? Have they had a previous DKA episode? Are they compliant with their insulin or medications? And what do their recent investigations, like HbA1c or fasting blood glucose, show? Next, perform a thorough physical examination. Focus on the ABCs. Assess vital signs, especially the Glasgow Coma Scale, to gauge severity. Look for signs of dehydration. And support a fast diagnosis by checking random blood sugar or using a urine acetone dipstick if available. Key investigations include random blood glucose and arterial blood gas tests. Checking for ketones in urine. A complete blood count, blood electrolytes, and renal function tests like BUN and creatinine. And don't forget an ECG to rule out any cardiac complications. The diagnosis of DKA depends on the presence of the following key criteria. First, the patient must be a known diabetic, or their random blood sugar, or RBS, should be greater than 200 mg per deciliter. Second, there must be evidence of ketones in the urine, indicated by ketonuria of +2 or higher, or ketonemia with levels greater than 3 millimoles per liter. However, it's important to note that the absence of ketonuria doesn't completely rule out DKA. Third, the patient must have acidosis, indicated by a pH of less than 7.3. Finally, the bicarbonate level should be less than 15 millimoles per liter. Remember, DKA is a medical emergency. Early recognition and prompt treatment can save lives.